The Milton J. Dance Head and Neck Center was established over 35 years ago by Milton J. Dance and his wife, Jenny Vance. The center's mission initially was to provide rehabilitation and counseling services to all our patients. Over the years, we have learned that early intervention and following our patients during and after treatment optimizes patient outcomes. We will now begin with a case study.
Mr. Hubbard is a 63-year-old gentleman who I saw last week with an 8-month history of a right-sided neck mass. He had no pain from it, no problem swallowing. He's quite functional and his ECOG status is a 0. His past medical history is significant for a heart attack, which he had in 2005, where stents were placed, but he seems to be doing fine from a cardiac standpoint. He is currently engaged. He runs a business with his colleague, but he does most of the legwork and actually gets up at 3 o'clock every morning, so that's something to consider in terms of his treatment pathway. And currently he has no insurance. On exam, what's most obvious in him is that he has this large 4-centimeter right-sided neck mass in the level 2 region, which is very freely mobile. Again, it's non-tender, doesn't appear to be affecting the overlying skin. He also has a 2 to 3 centimeter right-sided tonsil mass on exam, which you can feel to be quite palpably firm, and again, it remains mobile. In the office, we took biopsies last week of the tonsil and of the neck mass, and both of these came back squamous cell carcinoma. The HPV status of these are both pending at this point. So I'm going to stage him as a likely T2, N2A, stage 4 squamous cell carcinoma involving his right tonsil and right neck. So in our discussions last week, we talked about possible treatment algorithms, one of them being primary chemoradiation with twice daily hyperfractionated radiation along with weekly cisplatin, versus perhaps a more primary upfront surgical approach whereby we would remove this tonsil robotically, perform an upfront neck dissection followed by postoperative chemo and radiation. Given his current situation, he seemed to favor going with the primary chemoradiation, so we'll set him up to see Dr. Zinreich from radiation oncology and Dr. Levine from medical oncology.
Dr. Ha noted that Mr. Hubbard needed financial assistance at the time of the treatment planning appointment. He was able to arrange for the social worker to meet with Mr. Hubbard immediately after his appointment to address his concerns.
I recently found out what the problem I have, and I had to drop my insurance about 5 years ago after my heart attack. My insurance went over to $1,000 a month, and I knew at that time I could just not afford to have it. And it seems like once you drop it, I've had it all my life, and it seems like once you drop it is when you really need it.
Okay, well GBMC does have a financial services department, and they can help you with some options for paying for the medical bills. And the first thing we'll need to do is complete this financial application.
Okay.
So we can go ahead and look over that and complete it now.
Okay.
Our multidisciplinary team coordinates a pre-treatment counseling session for the patient. We encourage family members to attend as well.
The purpose of this meeting is to, one, just introduce ourselves to you so you can have some familiarity with who we are. And we're going to talk about each of our roles and the services we can provide for you. But we also want to hear from you as to what your understanding of the upcoming treatment is, so that we can address any outstanding concerns or questions you may have.
The social worker's role is to assess psychosocial, emotional, and financial needs, reviews anticipated adjustment issues after surgery or treatment, reviews the discharge planning process, refers for additional interventions if indicated, and informs patient of available support services. The nurse specialist reviews current and past medical history, reinforces information provided by the physicians, describes the planned procedure and treatment plan, and describes the expected self-care needs during and post-treatment. The speech pathologist discusses anticipated swallowing changes and treatment-related side effects, discusses anticipated voice problems, discusses anticipated speech production and articulatory changes, and educates on post-treatment interventions and rehabilitation needs. The dietitian reviews current nutritional status, assesses the need for supplemental nutrition and/or hydration before and after treatment, and provides patients with a Dance Head and Neck Center cookbook to assist in maintaining adequate nutrition during and post-treatment.
Before we get into discussing more of the treatment details, can you talk to us a little bit about your biggest concern in facing this diagnosis and treatment?
The biggest concern is my job. That's my whole life. That's what I depend on for everything that I do, my family and everything else. And I'm just so afraid that I'm not going to be able to do everything I have to do. I have to work no matter what. There's no question. I have to be there 6 days a week.
What kind of support do you have in your life from family and friends? How do you see yourself coping with this?
I think I have a fairly good family life. The most important thing in life to me is my granddaughter. Whenever I see her or hear from her, there's a hope.
You're scheduled for your Port-a-Cath and bag insertions on Thursday, as well as that submandibular gland transfer. About a week and a half after the surgery, when the swelling goes down, you have an appointment down in radiation oncology for your treatment planning session. And that's when they do the CAT scan and they actually create the treatment that will best get rid of that cancer for you.
At the start of treatment, each team member meets with the patient to instruct him on prophylactic interventions and symptom management.
I'll follow you throughout treatment on a weekly basis, or touch base with Carrie when she sees you on a weekly basis. But these two things I want you to do throughout treatment. The first thing is called a TheraBite. That's this here. This is a jaw stretching tool. What this does is it passively stretches the jaw muscle. Patients that are undergoing radiation tend to get tightness in their jaw and they feel like they have a restriction in mouth opening. So this is a nice tool to just kind of keep the jaw muscle loose and keep the range of motion increased throughout treatment. To use it, it's very simple. What I want you to do is you're going to put your teeth on these dental pads right here.
Okay.
The numbers will be against your chin, just so that you know that it's upright. You're going to be squeezing with your hand to let your hand do all the work.
Okay.
Put the device in your mouth. As you squeeze with your hand, you'll feel your jaw start to slightly open. You want to squeeze just till you feel that gentle stretch in the back of your mouth. Once you feel that gentle stretch, you're going to stop and hold it there. You're going to hold it for about 7 seconds, and then you're going to release. Okay? So let me see you do it now. Go ahead and put it in your mouth. And squeeze down just till you feel a gentle stretch. Good, and hold. 1, 2, 3, 4, 5, 6, 7, and release. And you can take it out. You'll do that 7 times, and then you're going to do it 7 times a day. So you'll do 7 squeezes 7 times a day. Pretty quick.
That's a little strange feeling.
Is it? Do you feel that stretch in the back?
Yes.
So the key to this is you do not want to feel any pain. If you feel pain or headaches or anything shooting up to the back of your head, you've stretched too far. Bring it down a little bit because you want it to be very passive. Okay?
That's easy enough.
So that's your TheraBite. So the next thing I'm going to introduce you to, and I'll print this out for you before you leave today, but I want to give you a set of swallowing exercises that are intended to keep the lingual muscles, the tongue muscle, as well as the throat muscles active throughout treatment. So these are used to help increase the range of motion as well as the strength of your muscles.
Okay.
All of these muscles are important in safe swallowing, so it's important to do throughout treatment. You're going to do these every day, twice a day if possible. And then we'll continue them thereafter as needed.
The dietitian will follow up with the patient weekly or as often as needed to assess intake and weight. She provides tips and suggestions on what to eat and drink based upon the patient's specific side effects.
I want to definitely remind you that this is not a weight loss program, and even though I know you were looking forward to losing a couple pounds, my goal for you is to keep you at the weight that you're at now so we can keep your strength, keep you strong, and so you can feel as well as you can through treatment.
Mr. Hubbard then met with our otolaryngology nurse specialist to discuss oral care issues and other pertinent symptoms.
Well, good morning.
Good morning. How are you this morning, Karen?
I'm doing fine. How are you feeling now that you've gotten started on treatment?
I'm feeling okay.
We don't really expect the side effects of treatment to build up until later in the second week. But in the meantime, I wanted to make sure that you're doing your oral care routine because it's really important to keep your mouth clean and moist while you're going through treatment.
Well, I'm trying to take care of that.
And you're rinsing with the salt water and baking soda during the day?
Right.
Good. How about your fluoride trays? Are you using them at night?
I'm trying to. Sometimes it's a little difficult at night, but I'm trying to do what you ask me to do.
I know it can be difficult, but they're really, really important part of the treatment. And actually, you'll be using them for the rest of your life because the treatment changes the quality of your saliva, and your saliva normally plays an important role in protecting against cavities. Now, are you checking to make sure you're getting in enough hydration?
I'm trying to. It's very difficult when you're not used to drinking a lot. All of a sudden, say you're supposed to drink a certain amount. It's very difficult when, you know, for instance, I may drink a cup of water or a glass of water a day, and now you're supposed to drink so many ounces. But I'm trying to do what I'm supposed to do.
And it's any kind of clear liquid, water, Gatorade, iced tea, but it's the clear liquids that you need.
Okay, that's what I'm trying to do. I get a 32-ounce bottle of Gatorade, and that kind of regulates what I should be having every day.
Good idea.
Hi, Mr. Hubbard.
Hi, Karen. How are you?
I'm good. How's the first week of treatment going?
Okay. Not knowing what to expect, but pretty good, I think.
Okay. Well, I have good news. Your prescription assistance has been approved for your anti-nausea med, and I have the first week's script here.
Thank God. Thank you so much.
Oh, you're welcome. All you have to do is each week just call into the pharmacy to renew it, and they'll send it directly to the center.
As Mr. Hubbard began experiencing the side effects of treatment, individual members of the team consulted with him on managing his health and functional status.
I haven't had much of an appetite. This is a little bit more than what I expected, to be honest with you. It hurts. It's too uncomfortable to try to eat anything, and I know I've got to be losing weight because I'd rather not eat than go through the discomfort of what I've been experiencing.
Well, it's no surprise because in the last couple weeks since you've started treatment, you have lost about 10 pounds. So what do you think about getting started on using the feeding tube now?
I originally did not want to do that. I was trying to avoid it as much as possible, but I know I had to do something because this isn't working what I'm doing.
Well, our goal from the beginning was that you continue to eat, and Jacqueline will talk to you about that more too, but so you'll still be able to eat, but then we'll use the feeding tube to make sure you're meeting your calorie needs, okay? So this is the tube feeding formula that I'm gonna have you use, okay? This is what we give all of our patients, so everyone tends to tolerate it pretty well. There are a couple ways that you can use it with your feeding tube. This syringe that you're already using to flush, you're gonna use this, but I want you to pull out the plunger and completely set that aside. What you'll do is you'll just hook this up to your feeding tube, pour the can of tube feeding in, and just let it flow in on its own by gravity. And that's kind of the quick and dirty way of getting a can of tube feeding in. The other option is we use one of these bags. We'll get you a pole to hang at home, and you can put the tube feeding in this bag, hang it up on the pole, hook that up to your tube, and just sit there, relax, watch TV, take a nap, and this can give you your nutrition while you're just relaxing at home. And so these are all things that I'll send you home with today, and I want you to get started. If I'll give you a written directions of how many cans I want you to take, how much water I want you to take, and then I'll follow up with you in a couple days and make sure that you're handling it okay, and we'll just continue adjust and make changes as needed based on what your weight is looking like. Okay?
Thank you.
Mr. Hubbard, I understand that it's really important for you to keep working throughout this treatment. And I also hear from the team members that your side effects are really starting to increase and you're feeling it more and more. Can you tell me a little bit about how you're balancing self-care along with maintaining your job?
Well, one of the most important things to me is my family. And I have to work every day. I have to support them. And owning your own business, you don't feel like turning it over to someone else. You feel like you have to be there at 5 o'clock in the morning, and you usually work 12 hours a day. And with some of the side effects I'm having now, it's a little difficult. I try to, I have a couch in my office, and I try, after I get the trucks out in the morning, to take a break. But at times it's rather difficult. I have no choice, and fortunately, God's given me enough strength to do what I am doing.
Okay. Well, you remember we had talked about in the beginning about, I know you want to keep the job going and you want to do it yourself, but we had talked about thinking of people in your life who could help you with that. Have you been able to put in place any plans for coverage if needed?
Yes, two things. I'm trying to protect my business and my family, of course. I've got my son who said that he would give up his other job and come in to help. And also a former employee who used to be a salesman said he would open up and try to run the business at times when I'm unable to. So at least, worst comes to worst, that'll be one less thing I have to worry about as much.
Yeah. I know this is really hard for you to maintain treatment and the job, and I'm glad you're working it out as much as you can. But I just encourage you to, tap into those resources if you need to, and it's okay to take a break if you need to, because your health is the most important thing.
Well, it's very difficult when you've had to do everything yourself all your life, but you are totally right. I've got to rely on other people now.
One of the most bothersome side effects of treatment is oral mucositis. Many patients who receive concurrent radiation and chemotherapy develop grade 3 to 4 oral mucositis. There is no way to prevent the development of oral mucositis, but the team works with the patient on symptom management techniques, as well as oral hygiene to optimize comfort and oral health.
It's a little uncomfortable opening your mouth like that. And why do you open it? Just the whole back of my mouth seems like it's almost burning when you... It's very uncomfortable trying to swallow or even open your mouth wide.
One thing that's very important when you have the oral mucositis is that you really take meticulous care of your mouth, rinsing frequently with that salt water and baking soda mixture to keep your mouth clean and hopefully decrease the chance of you getting an oral infection.
Prior to the last day of treatment, our social worker provides Mr. Hubbard with a brochure from the National Cancer Institute's Facing Forward series, Life After Cancer Treatment. This literature reviews common feelings patients experience after treatment. It also includes tips and guidelines for maintaining a healthy lifestyle. In addition, Mr. Hubbard is encouraged to attend the Patient and Family Head and Neck Cancer Support Group that is held monthly on the campus of GBMC.
To get a diploma, you felt like you accomplished something, and it was a good feeling.
When treatment ends, the associated side effects resolve slowly. At this time, patients begin adjusting to what many refer to as the new normal. The multidisciplinary team continues to follow patients throughout their recovery, rehabilitation, and survivorship. The patient came back to meet with the physician and spoke with the dietitian, telling her that he can swallow only liquids. The patient was scheduled for a repeat modified barium swallow for further evaluation.
This is Mr. Hubbard. He's a 56-year-old gentleman who was treated with chemotherapy and twice-a-day radiation therapy for a T2N2A squamous cell carcinoma of the right tonsil. He is about 8 months post-treatment. He's coming in today with complaints of feeling like things are kind of getting hung up at the level of the thyroid notch, an increase in effort needing to swallow, as well as a feeling of a ledge almost in his throat is what he describes it as. So we're looking today to see if there is a possibility of an esophageal stricture, if he needs to possibly be dilated. In 1 week from today, he's scheduled for his post-treatment neck dissection. So if he does have a web, Dr. Ha is going to be dilating him at the time of his neck dissection. Okay? Good.
The results of the modified barium swallow did show multiple webs that were causing the patient significant swallowing problems. After his neck dissection and dilation, the speech pathologist started aggressive swallowing therapy with the patient that included daily swallowing exercises at home and visits to the clinic 3 to 5 times a week for several weeks. During this time, the patient and clinician would use various consistencies of food in addition to completing exercises to assist with diet progression. In conjunction with the swallow therapy, the dietitian met weekly with the patient for nutritional counseling. She reviewed tips and tools to help him eat the right things, eat enough, and maintain his weight.
I pulled out some nutrition facts from some of your favorite fast food restaurants and compiled a list of the foods that I think you'll be able to swallow, but that'll also be high in calories.
Okay.
So it might give you an idea of how to meet that calorie goal. So you can go to the restaurant and see what food has the most calories, and then you can help pick and choose.
Okay, sounds good.
And hopefully we can keep that weight up and
That sounds good. I've come a long way.
keep you off that too.
Thanks to all of you. I've come a long way in the last few weeks, and I'm gonna go further. I feel today better than I've felt in probably 20 years. There were concerns earlier, loss of weight, other things, and Dr. Ha told me I was probably carrying around weight I didn't need to start with. But as of today, I probably feel better and more safe in my life than I've felt in a good 20 years. I'm very at ease with myself, and I owe it all to GBMC.